People with physical disabilities often stop living active lives because they find it difficult to ask family and friends for help. Independence Gear creates solutions for more independent lives so that more and more people can work, escape pain, and live meaningful lives with others. Solutions for a more independent life. Independence Gear.
My name is Carl Christian, the CEO of Independence Gear. We are very grateful for the opportunity to present here today. I will tell you about our products and hopefully why our products are relevant to you. In Independence Gear, we know what challenges people in wheelchairs face in everyday life. The company was founded with Tord Are Meisterplass, who broke his neck in a ski accident in 2015. After Tord broke his neck skiing and became paralyzed from the armpits and down, the injury changed his life drastically. From the larger frames of identity, mobility, and activities, to the smaller everyday routines that suddenly represented major obstacles, personal hygiene, basic chores, and daily tasks. Tord told me during this time how difficult it was to accept he would not be able to manage his life on his own. Due to Tord's unwillingness to accept this new reality, as well as his innate stubbornness, Independence Gear was founded in 2016. Tord, Nikolai, and myself established a company together using our engineering backgrounds to create solutions for Tord's daily tasks he could not do on his own. That year, we fabricated a prototype of what we now call Dignum, allowing Tord independence in using the restroom. From that day forward, Tord was able to maintain a full-time job, travel, and live an independent life with his family, all of which before Dignum was created, Tord was not able to do. Today, he is completely independent of assistance. Finding solutions to the challenges Tord and other people with disabilities faced in everyday life has resulted in a company that has developed 2 products over the course of 4 years. They have been added to the product portfolio of the Norwegian welfare system and are available for free to people with physical disabilities via an application process. We have become well acquainted with people with spinal cord injuries in Norway and established valuable partnerships with the best rehabilitation hospitals and most relevant user organizations. Independence Gear has learned how to navigate the Norwegian health and welfare system and is now ready to find the right partners in carefully selected markets within Europe. We have an especially close cooperation with the Norwegian rehabilitation hospital Sunnaas, built up over several years. Together, we have created solutions that enable people in wheelchairs to become more independent in their daily lives. Today, I am going to tell you about 2 of these: Dignum for independence on the toilet and Spectum for independent skin inspection. For many people with spinal cord injuries, one of the biggest challenges in everyday life is going to the restroom. The reason for this is the loss of control over their rectal muscle, which forces them to use a method to start the bowel process, or to bypass the muscle altogether. This can be done by one or a combination of different techniques: laxatives in the form of pills or liquids, muscle stimulation with a finger, a surgical procedure called a colostomy, or flushing the large intestine with water. The challenges with many of these methods is that they can be hard for someone with reduced core muscles and arm mobility to use on their own. Our product Dignum makes it possible for people with various physical disabilities to empty their bowels and maintain personal hygiene without needing assistance. This gives users increased independence in one of the most intimate parts of their life. Another challenge Independence Gear has focused on is the risk of developing pressure injuries. Ingebjørg Irgens, chief physician at Sunnaas Hospital, interacts with patients developing pressure injuries daily.
Trykksår, eller trykkskade som det nå blir kalt, det er en skade som kommer i huden og eller det underliggende vevet. En skade begynner å oppstå i løpet av 10 minutter, og så kan et sår gjerne ta flere år å gro.
A patient at Sunnaas Hospital, Kjerstin Bang, got a pressure injury after a warm summer in 2018. She was more or less bedridden for 7 months because of this wound. Kerstin shared her experience with us, saying, "I'm just lying in my bed and I've gained a lot of weight. I have not washed my hair for many months and I've lost muscle. The muscles I had in my abdomen are completely gone, so I get tired just lifting my purse. My body withers away. I long to move again." Pressure injuries are a serious complication and affects the patient's entire life. Among other things, it can cause pain, reduced activity level, reduced sleep, social isolation, and reduced quality of life. Treating pressure injuries costs the NHS more than £1.4 million every day. And checking your skin every day is, according to the NHS, the second most important measure to prevent pressure injuries. But because most such injuries appear on the seat, lower back, or heels, it is challenging to closely monitor this part of their bodies for people with reduced mobility. This challenge is why we developed Spectum. Spectum has a custom-made camera for skin and a user-friendly design, created specifically for those with reduced mobility and at high risk for pressure injuries to use in their everyday life. Not only does users say there are physical health benefits from using this product, but also the mental health that comes with autonomy and peace of mind. It makes it easy for the user to feel in control of their bodies on their own. Here is one of Spectum's Norwegian users, Anne Margrethe, who has previously had challenges with pressure injuries.
My experience with Spectum is that it's very fun to use. I feel more secure. I can check my skin wherever I want to. And it's giving me a benefit for my health, and it's very safe to use as well.
Challenges associated with patient transport to and from the hospital, in addition to the risk of infection, are both decreased by the use of Spectum. With Spectum, patients can remain at home, monitor their skin, and if concerned, utilize video conferencing with their physician remotely. The physician can remain updated on the patient's health, give advice, or request they come into the hospital if necessary. Ingebjørg, with a PhD in telemedicine and pressure injuries, promotes this tactic with her patients.
Her på Sunnaas så har vi veldig god erfaring med å bruke videokonferanse i såroppfølgingen, sånn at de slipper å dra til sykehuset hvis de har fått en trykkskade.
Independence Care is a company that helps people with disabilities to live more independent lives. We do this by always putting the user's needs at the center of our product development process. This has led so far to Dignum for independence on the toilet and Spectum for independent skin inspection. Looking forward, we have several development projects lined up, and we're excited about increasing sales internationally by helping more people. If you would like to hear more about our products, whether you're a potential distributor, partner, user, healthcare professional, or have other contributions and ideas, you can contact us by phone or email. Tord, who started this company, experienced how a physical disability can fundamentally change your life. All humans want to live meaningful lives, and our technology helps people who often feel more isolated and less independent as a result of a physical disability. Join us in enabling more people to work, avoid pain, and live meaningful lives. Thank you.